right, and welcome back, everybody. I hope you had a nice break. And we are moving into our last and final innovation presentation, and then we'll have one more presentation after this. So I'd like to welcome today Cynthia Wong and Adrian Leung, and they will be presenting from Ontario Health on the overview of patient access and navigation. So I will hand that over to both of you.
Perfect. Thank you so much. I hope you guys can hear me. Adrian and I are actually at a conference right now, so excuse this mildly blurry background that might occasionally pop up. Next slide, please. Okay. So thank you for inviting the two of us to speak with you guys today. My name is Cynthia. I am a consultant with the digital health team with Ontario Health Central Region, and this is my colleague, Adrian. We're always very grateful for any opportunities that we get to engage with the community sector providers. So again, thank you for inviting us. Our presentation today is going to focus on patient access and navigation and the provincial tool that's being developed. So that's Health 811 over on the far left of your screen. And so the next slide, yeah. So this is the slide that you're seeing right now. This is the high-level conceptual model of access and navigation. The idea that we're depicting is that patients can access the system in a multitude of ways, depending on whether they may have an existing relationship with a service provider, or maybe they're aware of local services, or perhaps they're actually just taking care of a loved one who lives like 2,000 kilometers away. So today we're going to focus on the provincial Health 811 work. Perfect. Next slide, please. Okay, thank you. So the Health 811 work is really just an evolution of Telehealth Ontario, this product that many of you are probably well aware of. And the idea is simple. Enhance the Telehealth Ontario service by launching one website and one number to call, 811. In addition to improving the existing 811 service, the goal is to give Ontarians the ability to access health information digitally, as this would empower them through their care journey and also help with clinical providers in the initial triage. Next slide, please. So the problem that we're trying to solve, trying to access the appropriate healthcare service isn't easy, and that's coming from two people who live and work with the system day in and day out. So the pain points that we've listed on the slide probably shouldn't be a surprise to anybody here. So ultimately, our system is hard to navigate. Despite current investments, patients and caregivers are struggling to navigate Ontario's healthcare system and are waiting too long for care. In addition, in public polling, patients and caregivers consistently identify a need for a system navigation support and more choices in how they interact with healthcare providers. There's also a lot of phone numbers to remember or even websites. I think there's like 9 Telehealth Ontario toll-free numbers. There's many websites that provide healthcare service or provider information, but there's limited to no ability to connect patients to virtual care services through existing channels. Connecting patients to services within their local communities have also been challenging. So while Ontario Health teams are working to establish a centralized access point for information and navigation in order to help achieve the ministry's expectations for these OHTs, there still needs to be more still needs to be done at a provincial level. And finally, the Ministry of Health supports many programs that are designed to help connect patients to health and social services, including Telehealth Ontario, Healthcare Connect, all the local health lines, healthcare options, Connex Ontario, and many others. So in short, there are many programs in Ontario that help connect patients to health and social services. But the problem is, how do we ensure that the unique needs of each patient is also supported? So next slide, please.
And so this is where Health 811 comes in, and its objective is clear. We aim to serve as one centralized digital front door for all Ontarians, offering a place and service where citizens can access their health information, advice, and initial triage support and guidance on how they can be connected to the services they need, when and where they need them. It will be fully integrated with our healthcare system, including the Ontario Health Team model. Next slide, please. Thank you. The principles guiding Health 811 aligns with provincial priorities, starting with embedding patients, families, and providers in the governance and co-design of every facet of the service. For example, in April of this year, our provincial colleagues leading this work held 18 ideation sessions with over 300 participants and 10 key stakeholder groups. The stakeholders engaged include primary care, Ontario health teams, home and community care support services, home and community care service organizations, Indigenous health and equity groups, etc. Our work is also aligned with the paradigm shift of moving away from volume-based payment models to those that are value-based. There will be rigorous clinical oversight to ensure the triaging and advice provided are robust and backed by evidence and best practice guidelines. The product itself will also be flexible so as to accommodate the ever-changing landscape that is healthcare and innovations. It is our hope that providers will also find value in the product to access relevant health content, resources, and directory services that will enable and enhance their respective practices. Next slide, please. Dialing in on what's been happening recently, the Health 811 team and our region have been working with our 12 Ontario health teams to determine what patients will see on the homepage of the service that identify their local community. So you can see that here on a small photographic of that here on this slide. When the user selects a community area, whether they live in the area or they're just visiting, the square or the tiles that you see within that red box will change to reflect the local resources available. Please note that the geographic areas are divided by communities, for example, Newmarket, instead of the Ontario Health Team name, so that the experience is intuitive to the user. Our 12 OHTs, Ontario Health Teams, have submitted what their local councils feel would be important to service in the first iteration to be released on November 30th. So we're looking forward to the feedback once that goes live. Another worthy note is that this will be an iterative process, and there will be regular opportunities for OHTs to revise their tiles as the service evolves and matures.
That's exactly what I'm looking for.
Next slide, please. So that brings us to a close to our brief presentation. We're hoping to pitch a few questions to the community actually to gauge understanding of what's happening in the sector. Starting off with, what do you currently know about patient access and navigation? Followed by, what is your involvement with your local Ontario health teams, as that will be the central hub of communication and coordination within local communities. And how can this service support your work and vice versa? So maybe I'll just stop there and see if there's any input or questions.
Thank you. Thanks very much for the presentation. Much appreciated. My involvement with OHTs is serving on two of the boards, Central West and Mississauga. I've been somewhat involved in this through my work with OHTs and the establishment of the tiles. I was one of the reviewers locally. And I think the project has great opportunities here from the perspective of enabling people to move across communities throughout Ontario as their needs differ. And it's one of the big navigation challenges that I think all of us online have experienced over time, in that families are not necessarily located locally, or as you say, sometimes thousands of miles away, never mind Ontario. But the beauty of this, from my point of view, that I want to support, is it's not one door, it's one first door approach to local services and knowledge and information. And I think that's the piece that I found very enticing, and feel very positive that this is going to have good outcomes. And we're going to help people navigate in a way that they haven't been able to before. So I just want to make that comment And, I encourage you to continue down that road with local OHTs very engaged in this work and providing knowledge and information about where people can access their support and services, but also tied to not only digital connectivity for many seniors, as you well know, or even families may not have the time or the wherewithal to be able to work through a system like this. So certainly in our OHTs, we've been thinking about how can we further connect this to more real-time and with people online answering telephone calls locally. So I think you open the gate and then we take people from there, and sort of the way I read it. And then we localize the information and the knowledge to enable people to get access to service, if I'm reading this correctly.
Yes, and thank you so much for your supportive comments and feedback, and really encouraging to hear that you're deeply embedded in your local Ontario health teams and driving this work forward, because they are the primary driver for how we intend to integrate the healthcare system moving forward.
And I think it's also important that we recognize that we might not get it right the first time, but we all believe that, we've got to start somewhere where we have to make these small incremental steps. So like with even just choosing the tiles that people can see, yeah, this is just the first iteration. Let's see what the numbers come back as, and then it will evolve over time. And let's make the process not as onerous in the future, but at the first go, it might be a little bit more tiresome, but yeah, we don't intend to have this process the entire time.
But a forming, storming, norming, performing.
Mm-hmm, mm-hmm.
Thank you.
Thank you.
All right, thank you both. And we have a question in the chat from Ching, who says many caregivers are burnt out trying to navigate the system, and they're very exhausted trying to find all of the answers. So just any thoughts or comments there?
As sure, as without my my work hat on, like I understand, like even as a caregiver, when I'm trying to take care of my family or my parents, it is exhausting. Like, and this is coming from somebody who kind of knows how the system works already. So we hear you, and obviously, yeah, we have patients like with all the focus groups that we've had with patients and family, our PFAC, Patient Family and Advisory Council. It is something that we are looking at, and we do hope to improve, even for our own benefits in the end, right?
Completely agree. And just building off of what Cynthia said, we definitely have a co-design process with all of our partners and collaborators, including patient family caregivers. And just a quick personal anecdote that I actually used the Health 811 service this past summer for one of my family members who accidentally just keep it short, fell down the stairs, and we weren't sure. It was in the evening time. We weren't sure if we wanted to go to the ED, and the family member herself was reluctant to go to the emergency room because of the stories that they hear about long wait times and so forth. And through Health 811, we were given very robust triage and advice. And we did go to the emergency room, but we were armed with a lot of really helpful info and a lot of vernacular that we translated and transferred to the nurse on site at the emergency department. So that was extremely helpful, and as well as offering reassurance and evidence to my family member who was reluctant, but then was convinced to go because of the very robust, hey, I know why now I need to go to the emergency room because of the so and so and so forth. So that was immensely helpful. And we continue to evolve the service. So hopefully it'll just continue to mature and get better as we work together with our partners.
Okay, great. Thanks so much. I guess I did actually have another question. I was just curious if there are plans, or has this already been done, to roll out education around this? Because I know, sometimes folks aren't necessarily aware of this new resource, or kind of all of the services it might be providing.
So maybe I'll start.
Yeah.
It's a work in progress. Terry, you bring a really good point. I mean, when Health 811 first was launched, it was called Health Connect Ontario. And definitely we encountered some scenarios where we were finding it was difficult to find in the first place. So it's an evolving process. We've done some, search engine optimization and some campaigns to start building awareness, but also recognizing that it's very much the product itself is a work in progress. So the marketing and awareness building is very much happening in parallel with the product maturity as well. So recognizing that, we want to get people's first reaction. We may not want all 15 million Ontarians access all at once in the first go.
For
We
sure.
want our partners to give that feedback, and I don't know if
Yeah.
something to add.
Yeah, no, that's exactly what I'd like to add as just to say is that like it's continual process improvement really. So
Okay. All right, great. And if there's anybody here today on the call who maybe isn't as involved with their local LHT, OHT, how can they ensure that their services are represented on 811?
Sorry, was your question about not
if
being
they
connected?
just
Oh,
if-
they are.
Yeah, if folks maybe aren't as involved with their local OHT or, find that their service isn't represented on 811, or maybe they want to change those descriptions, is there someone they reach out to, or that's still a work in progress too?
Yeah, so feel free to reach out to Cynthia or me, and because Ontario Health Team model is still very much intended to be that local hub of communication and coordination, if they're having, let's say, communication barriers or encountering issues accessing their local OHT, reach out to us and we can help connect you to the right people in the right places.
Okay, great. All right. Well, I don't see any other questions in the chat. So thank you both so much for your time and calling in from another conference.